Your doctor is recommending cardioversion. Why do you need cardioversion? The heart is a muscle. When it contracts, blood is pumped out to your body. The contraction is caused by an electrical signal. The electrical signal originates in one part of your heart and spreads to the rest of your heart. Normally, this electrical signal occurs in regular intervals. This results in evenly timed pumping of blood from the heart. Sometimes, the electrical signal misfires. The signal fires too frequently, irregularly, or spreads across the heart erratically. The heart then contracts rapidly and irregularly. Cardioversion is a procedure that tries to correct the electrical misfiring of the heart. How is cardioversion done? Because the irregular heartbeat is caused by misfiring electrical signals, electricity is used to reset it. This is done by placing soft pads on opposite sides of your chest. You are then put to sleep with IV medication. While you are sedated, you are monitored by the doctor, nurses, and a respiratory therapist. You will be connected to a heart monitor and be given oxygen. Then, an electrical current is briefly passed between the pads and through your heart. This electrical current resets your heart's electrical signal so it begins firing normally. What are the benefits of using cardioversion? Cardioversion resets your heart's electrical system so that your heart contracts at a normal and even rate. Irregular and rapid rates can make you feel weak and dizzy, like you're running all the time. And if left untreated, dangerous blood clots can form in your heart. Are there any risks from having cardioversion? Rarely, cardioversion causes another abnormal heart rhythm. This can usually be seen immediately and treated. If an abnormal heart rhythm has resulted in a blood clot forming in the heart, there's a small chance of cardioversion dislodging the clot. These clots can go to your lungs or brain, resulting in breathing problems or even a stroke. There are ways to minimize this risk. Are there alternatives to using cardioversion? Medicines can sometimes correct rapid and irregular heart rhythms. If cardioversion is being considered, then medications have likely not been successful, or your doctor believes that cardioversion will be more successful. What precautions are taken to avoid complications? There is no way to predict if your heart might go into a different abnormal rhythm. But during the cardioversion, your heart rhythm is continuously monitored by your doctor. If an abnormal rhythm occurs, your doctor can often treat it immediately. To avoid the risk of dislodging a blood clot, blood thinners are sometimes used. Also, prior to the cardioversion, studies can be done to examine your heart for evidence of blood clots. Do you consent to receiving cardioversion? Now that you understand why cardioversion is done, how it is done, and the benefits and risks of cardioversion, your doctor needs your consent to proceed.